Dr. Karthik Dinoja, periodontist, implantologist, founder of Karthiktva, and the voice behind India's most famous dentist. Winner of the Golden Mike Award for Best Dental Podcast, honoured as Dental Influencer of the Year by the Dental Excellence Awards, and recipient of the Smileverse Award by the Indian Dental Association. Dr. Karthik brings you conversations that go beyond clinical success and into the real journeys behind it. This is where dentistry's biggest names reveal what success really looks like. The mistakes, the challenges, the lessons, and the moments that changed everything. The conversations behind the careers. The stories behind the success. Welcome to India's most famous dentist. A podcast by Karthiktva.
You're absolutely right.
Thank you very much.
Whatever you are doing at the moment is also serving the nation.
Thank you, Dr. Karthik.
Listening to podcasts such as yours, you are not doing dentistry, you are doing self-development.
So, what are you waiting for? Grab your popcorn, sit back, relax, and enjoy the show.
Okay, अब आज के सोशल मीडिया के टाइम में बहुत सारे मेंटोर्स अपने आप को फेमस दिखाते हैं. And I feel that famous is not always useful and
Definitely.
expensive is not always deep.
Definitely.
तो अगर आज के UG, PG या फिर clinicians उनको अगर if they are in search for a good, again I'm telling you good mentor, so what are the green flags and red flags they need to keep in their minds? मतलब directly हमें मालूम पड़ जाए. एक तो जैसे आपने बोला documentation, I got your point कि ये तो देखना ही है कि जो हमें सिखा रहे हैं वो वर्क उनका बोल रहा है कि नहीं.
Yes.
उसके अलावा कौन से पॉइंट्स है which we need to check?
So once you leave your college, you can take some of the money that you might have kept for MDS
Okay.
and maybe choose to do some high quality courses over the next couple of years with your quality mentors.
Okay.
So that's one option. You don't always have to do MDS if you are planning to be a clinician in your private practice. If you need to get a job, if you want to, get a job in a college, or you want to become a staff or a professor, then yes, of course, MDS is very important. But
Right.
clinical dentistry में इतना फर्क नहीं पड़ता है. Especially if you're planning to do your own clinic.
Okay.
If you want to become a consultant and you want to travel, then yes, MDS also has value.
Yeah.
But
वो एक टैग लग जाता है.
हाँ, फिर वो MDS को तुमको बुलाएंगे, you will do consultations, all those things are fine. But if your main goal is private practice in your own clinic, MDS का इतना value नहीं होता. You could think of, I'm not saying that's the only way, I'm not saying that's the only correct way, I'm just giving one side of the story. That side of the story is that you could use some of that money in your own practice. You could use some of that money to educate yourself over the period of time in the coming next 4, 5, 7, 8 years.
Right.
And each year, I would recommend not doing more than one course because you cannot absorb the material and equipments and techniques that they have taught you more than once in a year. So you do that 1 year, try to implement those things that you learned in the course in your practice. And every 1 to 1.5 years, even once in 2 years, you can then do a nice high quality course either in India or even going abroad.
If you believe in quality work.
If you're only focused, see,
Yes.
I'm only talking about hardcore clinical dentistry in private practice.
If your just motive is to collect
Yes.
certificates,
Yes.
तो ये advice
Certificate
आपके लिए
again,
नहीं है.
that's irrelevant, right? So yes, so now let's come to the thing that you asked me earlier. How do you choose a good course in India or abroad? You first choose the mentor, right? How do you choose a mentor? Your mentor, because you are a clinician, you want your mentor to also be a hardcore clinician.
Right.
You don't want the mentor to first be an educator or a speaker. You want the mentor to be a clinician like you, so that at least 80 to 90% of his income and his professional time is actually spent doing the same thing you do, which is what? Sitting in front of a patient, and working inside the patient's mouth. So you need somebody who is a hardcore clinician. So the course that you're attending should be by the clinician and for the clinician. That is number one. Number two, it is a huge bonus and a huge green flag if that mentor is regularly posting cases on his or her social media.
Right.
And not just like the show off posts, but actually showing the insides of the cases, actually showing the intra-operative workflows, not just the pre-op and post-op and fancy reels and all those things, but hardcore daily clinical dentistry. And with today, the social media, things like stories. So I'll tell you something. I know that in Instagram, you have stories and you have your reels, right? And posts. So reels can get you more followers, it gives you more reach.
Yes.
But for me and for many people who follow me regularly, I think stories creates a big depth
Okay.
with my community, because I am posting cases for them just for those 24 hours so that they can see in depth what is happening in my cases.
Right.
So I don't care that much about the width or the broadness of my base. I care about the depth of my base. And that is the kind of mentors that I feel you should be looking for people who are genuinely showing their cases every day.
Right.
And stay away from mentors whose personality and ego first enters the room and then the work.
The work should enter the first.
The work, the quality of your work, because you are a clinical master. You're trying to show yourself as a clinical master. So first show your work, then show who you are. Your work should always precede you, not the other way around.